Hello, welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I'm going to be speaking with Dr. Ali Sajadi. Dr. Sajadi is not only a master clinician, he's worked in the insurance world, is a national lecturer, and also does research. He's a clinical professor at the University of Texas School of Dentistry in Houston, and he's received a number of leadership and excellence awards during his career. Welcome, Dr. Sajadi. Thank you for talking to me today.
Thank you, Liz. I'm more than honored to be here and to share a little bit about my history and my thoughts and philosophy on StellaLife.
That is wonderful. Thank you. So you've had a multifaceted career from medical research to health management and health insurance. You ultimately became a periodontist, and you're a pioneer in the collaborative multidisciplinary approach to patient care. So can you please tell us about your business model and your holistic approach that you follow in your practices?
Sure. In 2014, actually towards the end of 13 into 14, um, I had been a resident in periodontics about halfway through my program and realized in spending time moonlighting on the weekends that there was a loss in translation between patient care and interplayed connections with referrals. And a lot of times, as we move into a more modern age, technology tends to have its benefits and its disadvantages, and expectations of the past don't always follow. And so for me, it was really important to create a multidisciplinary model where the specialty teams would be able to collaborate almost as a think tank on each patient that comes in through the door. And if you look at that model, it has been very successful across many corporate platforms in dentistry in the United States and beyond. And realistically, that map and that workflow tends to get watered down when you have multiple offices. And so we wanted to offer a single source group that wasn't going to expand beyond a certain number, but was going to offer high quality care, be affordable at the same time and accessible to several of the patients through insurance, but realistically meet every need that could be met within the confines of a modular dental practice. The holistic approach and how that kind of came across is that as we are progressing into more modern times in medicine, people are looking for alternative forms of medicine because what we know and what we've studied in the past, though evidence-based, may not always be the best solution for every patient. And that doesn't mean that other solutions are unapproachable. It just means that their research is probably limited. And so being an open box type of person or outside the box thinker, I wanted to make sure that we had opportunities for patients to express their concerns, their interests, bring in their information, and then vet it. Realistically, as a researcher, you're supposed to be open to any concept that comes through and you want to research it. And that's kind of how I fell upon the products at StellaLife. Realistically, their product line is of a holistic and natural based approach, being that they have a complex of over 17 different natural ingredients. And for me, that's an important solution if it resolves the same concerns like pain and anxiety or disinfection of the mouth. Well, I'd rather use the natural or more holistic approach than the chemical approach.
Definitely. And you, with your model, you are really making it so much more convenient for your patients, and also being able to clearly communicate with them, because so many times people don't move ahead with treatment because of the confusion, but because you have everything so organized. It really makes it a better service, the best possible one for your patients. And then we appreciate you being a StellaLife doctor. So it's nice because the patient compliance is good, works for them, and it also tastes good, which I
Yeah.
always really enjoy that because the patients appreciate that so much. But as a clinician, with your extensive background, you treat some pretty complex surgical cases. And I know you have a passion for the rehabilitation and regeneration of facial and oral tissues. So, using a natural approach, including StellaLife, tell us about your facial therapeutics that's part of your practice.
Absolutely. Yeah, we embarked on that a few years ago under the direction and really the education led by the Care Aesthetics Group and Dr. Myron and his team. And the facial therapeutics industry is an incredibly growing segment of medicine. Currently, it's on project that by 2028, it will outpace many of the normal routes of medicine and dental care that we seek for surgical intervention of facial and aesthetic concerns for patients. Up until now, we used chemicals and or synthetic products to try to achieve a result for patients that were expressing concern about certain aesthetic issues. And in the last few years, the research that is kind of developed through Dr. Myron's group and others in the expressive unlocking of power of healing through platelet-rich fibrin has given us a modality for which we can use autologous or same blood product from that patient and using to achieve some of those same results with a natural or holistic approach. And being that kind of office that looks at those new age modern style treatments that minimize the use of chemicals and additives, we looked intently into it and trained and sent our entire team to be trained on these. And now we've been offering it quite successfully to our patient base and beyond. And the solution is a wonderful solution for those looking to rehabilitate or revigorate really their face and their facial aesthetic concerns. We can achieve wrinkle reduction. We can achieve almost a smoothing of the face, similar to a mild version of a facelift, as well as augmentation of areas that people may have had concern with in the past. And everything that we use is straight from the patient. So there's not any cross-contamination issue. There's not any reaction issue to any of the materials. It is God's way of healing your body, and we're harnessing and unlocking that power. So I'm really excited to be able to couple a holistic product alongside a holistic treatment flow with StellaLife.
Yeah, absolutely. And as far as like having aesthetics as part of the practice of facial aesthetics, all of us have heard, from patients who've had maybe a smile design, a full veneer case or whatever, and they say, "Well, now my teeth look great, but can you do something about my lips? Because of the
Right.
wrinkles or whatever." So that's really the curtain. So if we're going to be doing aesthetics, it's beautiful, literally, to be able to offer that full service for the patient and it's so exciting for them. And then they trust you, they're familiar with you, they know how well they're going to be treated when they come in. So with that relationship, and of course, having both things going, you've got incoming patients that are looking for these two different things. So it's a great way to, get more referrals and get patient flow as well. Pretty
Absolutely.
exciting stuff. Yeah. So, on all the other things that you're doing, it includes being a national lecturer, you're a published author, and a researcher. Tell us about the research that you're doing.
In the past, I focused on osseous tissue lesions and infections around implants, and we were successful in getting some publications that talked about infections around dental implants and how to treat them. Today's research focus, I've got a couple of different fronts. One, looking at the um, essentially the patient experience, the anxiety and the pain scale, and how different products on the market can achieve the same result of pain and anxiety control without the use of opioids and or controlled substances, because that's a huge epidemic in the United States. And it seems that there's a lot of good research being done and some in the dental front, but we really want to understand what the patient's perspective is, because pain is subjective. And I've treated patients that have had a full mouth rehabilitation with implant care and expressed that they had no discomfort and took an ibuprofen the following day, and that was about all they took. And I've had a patient that had essentially a deep cleaning and waited for weeks and still complains of discomfort. So I think that being pain is relative, and it's relative to the patient, anxiety as well. We want to understand from their perspective what's going on. And that's one of the focuses of my research now, in addition to understanding the diagnosis of periodontitis in the United States and the accuracy with which we're seeing. Some of the most recent census reports indicate that over 50% of Americans are walking around with some sort of gum disease. Well, gum disease is also a harbor of other issues like heart disease, diabetes, and other things. It's an inflammatory mediated process that expresses its symptoms when there are other things at play. And so if we can look at a diagnosis accuracy relative to the diagnosis criteria maybe medicine and dentistry can combine forces to find some of these issues and treat patients before they get too severe or too costly for the healthcare system in general. And so my focus there now is to look at the diagnosis accuracy in the United States, and then look at some of the products that, like StellaLife or others, that can help reduce pain and anxiety for the patient experience.
Yeah, I admire your eagerness to learn and explore, and also your compassion for each patient as an individual. Because, having been a hygienist for over 40 years, sometimes we like we're not always patient with people because we figure, well, they shouldn't be in that much pain. There may be something else going on, but we need to recognize that and provide the support that they need. So, and with the epidemics of the opioid crisis and perio, I've been a longtime trainer, in-office trainer with the JP Institute. And when we look at patients' tissue, basically, if their gums are bleeding when we probe or when they floss or when we're doing a prep, then when you look at that statistic, it's more than 50% of our patients that come in with bleeding tissue and the
Right.
perio then. So it is a widespread epidemic, again, with all these systemic issues that go along with it. So I'm very grateful to you for what you're doing for your community and the world at large. So continue on, and really appreciate your time today and sharing what you do with all of us. So thank you again for joining me today. And I really want to thank everybody else who's on the call today. And that was very inspirational to me. So I hope you're all inspired. And until we have our next segment of the Innovator Series, please stay well and stay happy. And I look forward to seeing you next time. Thank you all so much. Thanks, Dr. Sajadi.
Thank you. It was an honor.